Generally, your doctor will recommend surgical treatment for chronic lower back pain only after you've tried and failed to get relief from non-surgical treatments. And your doctor has to believe that there's a very good chance of substantially reducing your symptoms and helping you regain normal function. People with chronic lower back pain and sciatica are some of the most frequent candidates for surgery. These patients often have a herniated disc, where the inner center pushes through the outer ring, spinal stenosis, where age-related narrowing of the lower spinal canal pinches nerves, spondylolisthesis, where one vertebrae slips forward over another, or vertebral fractures with nerve involvement due to osteoporosis. Another group is those with degenerative disc disease. Candidates for surgery generally have pain that is constant or occurs frequently enough to interfere with sleep, functioning at work, or performing daily activities. If pain is associated with a sudden change in sensation, the ability to move or control of the bowel or bladder, emergency surgery may be required. A variety of surgical treatments are available for appropriate candidates. If you're considering surgical treatment for lower back pain, you will have to make the final decision about whether your symptoms are severe enough and medications and physical therapy aren't working well enough to undergo an invasive procedure such as the ones described here. Spinal cord stimulation, or SCS, uses electrical signals to the spine to mask pain signals being sent to the brain. Unlike other surgical procedures, SCS allows patients to experience the therapy in a reversible one-week trial. The procedure is similar to an epidural, a common procedure used to alleviate pain during childbirth. For the trial, your doctor threads wires called leads from an external stimulator to the epidural space, the area outside the covering of the spinal cord. The stimulator delivers electrical pulses to mask pain signals. Instead of perceiving pain, the brain perceives tingling sensations. A remote control enables patients to turn SCS on or off whenever they choose. The therapy is tested for a week to see if pain is reduced. Treatment of lower back pain with SCS is highly effective in many patients. Some are able to reduce or even completely stop taking drugs for pain. If the trial is successful, you and your doctor may decide to implant a permanent device called a neurostimulator. Many types are available. You and your doctor should discuss which is best for you. Implanting the neurostimulator is a simple procedure, usually done on an outpatient basis. The device is placed under the skin, typically in the upper buttock. After the procedure, your doctor will give you instructions for using the stimulator at home. Since its initial approval by the FDA over 30 years ago, SCS has undergone many improvements. Recent advances such as reductions in size and rechargeable devices have made the therapy more effective, longer-lasting, and easier to use and control. SCS can have complications. These include migration of leads, infection, device malfunction or lead breakage, and bleeding. Open decompression is a surgical procedure to relieve pain caused by pinched nerves, also called neural impingement. A small portion of bone over the nerve root and/or disc material from under the nerve root is removed to give the nerve root more space and help healing. Open decompression may be carried out alone or along with discectomy, in which lamina, the thin bony layer over the spinal canal, is removed to relieve nerve pressure or create access to the disc. Any pieces of disc that are pressing on nerve roots are removed. If a piece of lamina is removed, the procedure is called a laminotomy. Removal of the entire lamina is called a laminectomy. Lumbar spinal fusion surgery for lower back pain is generally only considered when 6 months or more of extensive non-surgical treatment, such as physical therapy, medication, and injection therapy, fails to provide sufficient pain relief. In addition, patients must have ongoing pain that limits their ability to function in daily activities at work and home. And patients must be unlikely to receive significant benefit from other invasive procedures, such as neurostimulation or intrathecal drug administration. Patients who are possible candidates for spinal fusion may first undergo discography, a procedure where your doctor injects dye into the appropriate disc to help identify the source of pain. The amount of pressure needed to inject the dye, the type of pain you feel, the amount of dye used, and an X-ray of the dye inside the disc are all assessed to help determine whether your symptoms are being caused by changes to the disc itself. The spinal fusion procedure involves joining 2 or more vertebrae together using bone grafts, screws, and rods. Bone for grafting usually comes from the person's own hip or pelvis, but sometimes bone from another person is used. Spinal fusion can be done through the back or through the front, or sometimes both ways. Regardless of how spinal fusion is performed, the fused area of the spine becomes immobilized. Spinal fusion is carried out under general anesthesia, and you will probably be in the hospital for 4 to 5 days. Selecting the source of bone used for spinal fusion is an important decision. Using your own bone means surgery at a second site on your body. With donor bone, there is a slight risk of disease transmission or rejection. A recent development has eliminated this problem for some patients. Molecules called bone morphogenic proteins are now being used to stimulate bone generation, eliminating the need for grafts. A sponge soaked with these proteins is placed in the affected area of the spine, and they help to stimulate rapid and beneficial bone growth. The sponge material is absorbed by the body after the proteins have done their job. The results of spinal fusion for the treatment of lower back pain vary from one patient to another. A good result is a decrease in pain of 50% or more, and this is achieved in about 60 to 70% of patients. It is very rare for someone to be completely pain-free after a spinal fusion, and full recovery can take more than a year. You should also be aware that spinal fusion surgery has significant risks, including infection, bleeding, nerve injury, severe pain, and the need for repeat operations.